Welcome to a short video about ADHD. This is Will. Will has Attention Deficit Hyperactivity Disorder, or ADHD. Will's story begins when his fourth grade teacher noticed how well he did while taking a makeup examination alone. Isolation allowed him to concentrate. While working in a room with other students, he became easily distracted. She wondered if he had ADHD. Will's mother then had him independently examined by an expert. He confirmed the diagnosis, and at a later point, the school psychologist came to the same conclusion. So what does this mean for Will? To answer that, we must first define and characterize this disability. Instead of listing ADHD as a separate disability category, IDEA includes it as a subcategory of other health impairments. Under the IDEA definition, a student with other health impairments has limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment. This other health impairments category also includes chronic health conditions of asthma, attention deficit disorder, or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, rheumatic fever, sickle cell anemia, and Tourette's syndrome. However, ADHD accounts for almost 2/3 of this category. So how does someone determine if a student has ADHD? Well, the slash indicates that there are 3 subtypes: attention deficit disorder, hyperactivity disorder, and a combination of both. The characteristics must be present for 6 months and fall outside the range of adaptive behavior. To be classified as predominantly inattentive, the student must exhibit 6 or more of the following. The student will often fail to give close attention to details or make mistakes in schoolwork, work, or other activities. They will often have difficulty sustaining attention in tasks or play activities. Often does not seem to listen when spoken to directly. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. Often has difficulty organizing tasks and activities. Often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort. Often loses things necessary for tasks or activities. Often is easily distracted by extraneous stimuli. Often is forgetful in daily activities. To be classified as predominantly hyperactive or impulsive, the student must have 6 or more of the following characteristics of hyperactivity or impulsivity. If the student exhibits hyperactivity, they will often fidget with hands or feet or squirm in the seat. Often leave seat in classroom or in other situations in which remaining seated is expected. Often runs about or climbs excessively in situations in which it is inappropriate. Often has difficulty playing or engaging in leisure activities quietly. Often is on the go or acts as if driven by a motor. Often talks excessively. If the student exhibits impulsivity, they will often blurt out answers before questions have been completed. They will often have difficulty waiting to take turns, and often interrupt or intrude on others. So what are the possible causes of ADHD? Well, heredity plays the biggest part. Studies suggest students are 40 to 50% more likely to have ADHD if a parent also has the disorder. Structural and functional differences in the brain also play a part, specifically in the frontal lobes, cerebellum, and basal ganglia. Statistically, brain volume of students with ADHD are 3 to 8% lower than those of their peers. Finally, environmental causes such as prenatal smoking, drinking, and lead toxins, as well as postnatal environmental toxins, have been linked to the disorder. So now that we know what to look for and some possible causes, what is the process of evaluation? Well, it starts with the teachers and parents, who first observe the possible behaviors, just like Will's 4th grade teacher did. The next step is assessment and screening of the student by assessing work products, group intelligence and achievement tests, as well as having a trained physician conduct medical, vision, and hearing screenings. The next step is preferral, where the teacher implements suggestions from a school-based team. If the student still exhibits factors of the disorder, then a referral is submitted so that the student can receive a full evaluation from a multidisciplinary team. Psychological evaluations, individualized intelligence test, individualized achievement tests, Behavior rating scales, teacher observation, curricular-based assessment, and direct observation will all help to reach a final determination from which an IEP team will develop appropriate options for the student. And then students, like our friend Will, can receive the assistance that they need.